Greetings to one and all. I would like to just highlight few things about the hysteroscopy. Hysteroscopy is a diagnostic as well as a therapeutic tool. So there are few group of patients who really benefit a lot by this procedure. It is not recommended procedure for the whole population as a whole. Usually if we'll have to do a hysteroscopy, we will have to do it roughly between the 6th to 10th day of the menstrual cycle to be sure that the female partner is not already pregnant. So those who require the procedures are those who have unexplained infertility, who are suspected to have a tubal block, who carry some pathological or a functional cyst over the ovaries, or pathological cysts include those such as endometriosis and so on. And the hysteroscopy is done for those with suspected pathology intrauterine contributing to the infertility. The hysteroscopic identities would be those such as septate uterus or a polyp which might need a resection, or a submucous fibroid that requires a resection under the hysteroscopic guidance. There is a group of patients with very tight cervical internal os for whom either doing an intrauterine insemination procedure or the embryo transfer technique becomes too difficult. These patients benefit a lot by hysteroscopic guided cervical shaving technique. So whatever the procedure might be, we program them and ask them to come over a 6 hours fasting status, and those patients who require a laparoscope, we usually combine them with a hysteroscopy to make sure what the pathology is. And therapeutic hysteroscopy is being done as a well-planned procedure wherein the patient is very aware of what the pathology inside her uterus is, and then she undergoes the procedures such as septal resection or a polypectomy or a submucous fibroid resection and so on. For the patients who have repeated implantation failure as a cause of their failure in the ART technique, we recommend them to undergo a diagnostic hysteroscopy to look at the endometrium to make sure that there are no intrauterine adhesions contributing to the implantation failure, and if so, we try to do the adhesiolysis at the same sitting, and once the release of adhesions is being made, it would be easier for this female partner to get pregnant. So to put it in very short, this is not a recommended procedure for the whole group of population, but for those who have to undergo a hysteroscopy, this procedure would definitely benefit them more and do very less harm to them. This has to be carried out at a proper center by a very experienced hysteroscopist to aid them to have very good results at the end of the procedure. These are the few essential baselines of what the hysteroscopy means and what we are doing. To know in detail as to what procedure might benefit for you, we might have to go through your records and keep you informed about the procedure and the technique that has to be done. Thank you.